Okay, hello everyone. We waited just a minute for people to file into this meeting. My name is Barbara Fry, and I'm the director of the Human Rights Program at the University of Minnesota. And on behalf of the University of Minnesota Human Rights Lab and the Center for Global Health and Social Responsibility at the University of Minnesota, I would like to welcome you to today's webinar. I just wanted to give a heads up to the panelists and the attendees that we are recording this webinar, so you should be aware of that. Today's discussion is the first in a series of events that we are holding to advance human rights during the COVID-19 health outbreak. We are using this historical moment not just to address the immediate impacts of this crisis, but we also want to look beyond the events unfolding on a daily basis and to identify the gaps in protection and propose legal and policy changes that will advance human rights in the long run. We know that policies that are put in place during a crisis like this are likely to remain in place permanently. And this knowledge gives us pause, especially in light of the overreach of many governments that are using the COVID crisis to justify draconian restraints on their societies, on their laws that are now intended to silence political opposition or to demonize minority groups rather than protecting public health. Still, this is also a moment of opportunity, a moment in which we can envision a world beyond the crisis, one that more closely resembles the ideals set forth in the Universal Declaration of Human Rights. What are the best strategies for advancing human rights moving forward? What can we learn from this global pandemic experience that we can use to change the world for the better? We'll have a series of discussions on this topic, and you see the slide background that's up that frames the entire series. Our next event will be the third week in May, featuring Professor Catherine Sickink, who will be joined by others to talk about collective rights versus individual rights at this time. We're starting that envisioning process about the future today with this discussion on the right to health. The International Covenant on Economic, Social, and Cultural Rights, which was adopted in 1966, recognized in Article 12 the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. That same standard came out of the 1946 Constitution of the World Health Organization. International law guarantees the enjoyment of the highest attainable standard of health as a fundamental human right of every human being without distinction of race, religion, political belief, economic, or social condition. So joining us today to help explain the promise and reality of the right to health are three distinguished scholars and experts. Speaking first will be Dr. Larry Gostin, a university professor at Georgetown Law School who directs the O'Neill Institute for National and Global Health. Dr. Gostin is a professor of medicine at Georgetown University as well, and a professor of public health at the Johns Hopkins University, director of the World Health Organization's Collaborating Center on National and Global Health Law. Our second speaker is Dr. Balasubramaniam. I told him I would do it right the first time, but there I messed it up, who is kind enough to allow us to call him Balu. So Dr. Balu is a development scholar, author, public policy advocate, and a leadership trainer and activist known for his pioneering development work with rural and tribal people in Karnataka, India. He is a visiting professor at Cornell University and the University of Delhi in India. He holds fellowships at the Harvard Kennedy School and the Hauser Center for Civil Society at Harvard. And our third speaker today is Dr. Fionnuala Ní Éileann, a University Regents Professor at the University of Minnesota, where she holds the Robina Chair in Law, Public Policy, and Society. She is concurrently a professor of law at Queen's University of Belfast School of Law. And since 2017, Professor Nieline has served as the United Nations Special Rapporteur on the promotion and protection of human rights and fundamental freedoms while countering terrorism. We're delighted to have you all, and I want to invite our first speaker, Dr. Larry Gostin, to talk to us a bit about what are your primary concerns, your human rights concerns about this crisis, and ask you in specific whether you believe that the public health framework and the human rights framework are mutually beneficial in approaching this crisis. Dr. Gostin.
Well, thank you very much for having me, Barbara. The human rights implications of this pandemic are vast. I think human rights and public health can be synergistic, but they can also be, very conflicting. They're synergistic, I think, when we adopt certain principles. And the first principles for me are, is there good scientific evidence to suggest that the public health intervention is going to be effective? Using the sort of CUSA principles, is the intervention proportionate to the goal that we're trying to achieve? And is it the least restrictive alternative that we could use to achieve that goal? The other part of this is equity. Equity is critically important, both for human rights and for public health. And in a world that is so unjust, and in America that is so unjust, we're seeing the social contract, the social fabric fray in quite remarkable ways. And so what should we be aspiring to? I mean, I've been thinking about the very question that you raised, Barbara, which is how do you basically come out of this pandemic in a way that's respectful of human rights and equity? And I think we have several pathways. We could see these kind of, lockdowns, travel bans, overreaches as a new normal, and I could imagine that the next time we have an epidemic that we would spring to these kind of draconian measures. Under the same scenario, we could see the same kind of geopolitical divisiveness that we've seen, particularly against the World Health Organization, which has done such an amazing job. And yet we find it in the political crossfire between two superpowers in the most hurtful way. Just imagine in a once in a century event, we're actually blaming the World Health Organization rather than supporting it and strengthening it. Or we could have a different modus operandi. We could use this once in a lifetime public health calamity as a once in a lifetime opportunity. And so what would that opportunity look like? It would have a lot of different characteristics, I think. What's uppermost in my mind now is we would strengthen, empower, and support the World Health Organization. We would recognize it as the first United Nations agency that came out of World War II, and for all the good it's done in the world, not just in fighting this coronavirus epidemic, but in eradicating smallpox, in reducing malaria, tuberculosis, in fighting HIV/AIDS, in saving underage children, under 5 children, women in childbirth, working in injuries, mental health, non-communicable diseases. I would also like to think that we would have a renewed commitment to liberal democracy and human rights norms. To me, that's really critical because I think some countries in the world, perhaps Prime Minister Modi in India, certainly Xi Jinping in China, although they're obviously very different, have both really cracked down on civil society and independent scientists. And China in particular has projected itself as more relevant, more powerful than liberal democracies in Europe, North America, and they think they've handled this as well. But I think we actually should learn a different lesson. The lesson is that if we respect the freedom of the press, independent scientists, if we value science, if we place our respect and confidence in human rights, and we defend whistleblowers, that we actually can have a more transparent, rapid, and more effective response to an epidemic, that we don't need authoritarian rule to be able to do good public health. I think quite the opposite. We really need to focus on our core values. And so coming out of this, I would really hope that we might see, a world where our children would be proud to think that we're in a country and in a world that's equitable, that values human health and human science, and that values the human rights, not just collective rights like the right to health and the right to life, the right to a clean environment, but also civil and political rights, rights to autonomy, freedom of the press, the media, empowered civil society, all the things that make our world a wonderful place. I'll end by just saying this, one of the things, the last really major pandemic that we've had and we're still going through was the AIDS pandemic and is the AIDS pandemic. H1N1 influenza didn't turn out to be as great a threat as we thought it would be. But AIDS taught us something, I think, that's really very special and really important, which is if you want to make fundamental change for the right to health, freedoms, anti-discrimination, you use bottom-up social mobilization. You empower people, you empower civil society, and you do the right kind of research and funding and make the fruits of that research equitably distributed across the world. That's our guiding light. And if we follow that guiding light, it'll be a wonderful, much better world when we come out of this COVID crisis. But if we take the other path, the path of dogma, of draconian action, of anti-science, of dampening the kinds of human spirit that we can see all around the world, we're going to be in a very, very sad place. So let's hope that we take the right path, and that would be the path, in my view, of public health and civil rights.
Thank you so much, Dr. Gostin. That's a really great summary of a lot of the themes that we wanted to draw out in this, and we'll get back to some of the specifics in the Q&A. So, Dr. Balu, you find yourself in India right now. Could you give us a sense of, in the regions where you've been working, what are the political and societal conditions of this public health crisis, and how are countries responding to the inequalities that they find in communities even before this crisis hit?
Thank you so much. Thank you for having me on this panel, Barbara. And just to give a little background for the others who are participating in this webinar, India's healthcare systems are slightly different from the way you see the American healthcare system. We have a large public health system. Well, if I were given percentage numbers, close to 80% of the resources, infrastructure, personnel are in the public health system. 20% of the resources are in the private and the civil society groups. But the tragedy has always been that despite the public system having 80% of resources, latest survey shows only 34% of the people access these services, which means the most people actually access private health system services. I bring this up because it's got an impact on the way COVID response has been in India. Second, that primarily preventive and preventative work was seen as a responsibility of the public sector, but most of the clinical work, where the bottom lines were commercialization of healthcare, was actually controlled and managed by the private sector. Two other things I would like to give as a background before I get into the human rights proper thing is, we are having a draconian ancient law, which the British passed in India in the 1800s. It's called the Epidemic Diseases Act, and which is a law which is still being used, despite the current government has actually nullified or removed close to 1800 laws which were the pre-colonial period. This law missed the bus, or if I can say, I don't know whether it's deliberate or intentional, but this act still continues to be there. This is a law that the British brought in to separate the natives out. That's their thinking from the rest of the population. And we still use the same law now to control this epidemic. So that's one background. The second thing is, we also have another law which is called the National Disaster Management Act. And generally till now, the NDMA, or the body of people created under this act to respond in a crisis, have been doing exemplary work in India. Not necessarily, they never really had to face a pandemic till now. This is the first test case for them. But in every other natural disaster or man-made disaster, it is they who actually come in and save lives. And so, as a young child growing up, a big cyclone hit India and thousands were just dead overnight. And we couldn't even remember the kind of damage it did. But from then on to now, the NDMA has been so prompt in its action that it's actually saves, in a sense, millions of lives since it's been started. So with this background, the political and societal thing that you asked about, India right now has got political stability, which is reasonably recent. Earlier, it used to be coalition governments, but we have a majority government in the center. And many states do have these governments. And in India, there is a fine line where health is seen as a state subject, but the federal government actually also supports it with guidelines, policies, and resources. So if there's actually a pandemic, whose responsibility is it? Generally, technically, it's a state responsibility. Does the national government have a role to play? These were questions before the pandemic hit. But once the pandemic hit, the stability of the national government and the decisiveness that it acted, and a lot of other things under the central government's ambit, like shutting down the airports or closing international travel and stuff like that, which they could enforce, was actually initiated by them. And even the lockdown that we're facing, not just a recommendatory social distancing, but in India, it's actually called a lockdown, possibly the largest lockdown in history, where the whole nation has been indoors. And you'll be surprised, having lived and grown up in India, I would have expected riots on the streets. But strangely, this has been the most organized process that I have seen. This could also be because right now, whatever people may have views on this, the current prime minister is extremely charismatic with a substantially large number of the population. So if he gives a call, generally the youth, a lot of people actually take his words for as a final word, and maybe that's one reason he's been constantly in touch with people and talking on the television, talking on radio, talking to the chief ministers. So I think that the response has been maybe because of stability of government, stability of leadership, and the way the system responds. Typically, people talk on the streets as though they have no faith or trust in the government. But then when I look at what's happening right now, it seems that people are falling in line with the demands of the government. But for me, from the perspective of delivery of care and services in the pandemic, I feel that the private sector has let this nation down. It's the public sector that risen to the occasion. They have really done a phenomenal job as far as managing the epidemic in terms of organizing themselves, making sure the healthcare workers, the frontline workers are actually there out in the field, rendering services irrespective of whatever kind of backgrounds people come from. But strangely, the private sector is just withdrawn. So I'm not even sure if, to me, it's a violation of rights, because people are going to have tuberculosis and malaria and heart attacks and everything else, which they need other services to go to. So the whole public system has been focusing on the COVID crisis, and they're already overworked, overburdened, and overwhelmed. And in the private systems taking care of 66% of the patients of the country shut down, People have to go somewhere. People are unable to go anywhere, or they have to go back to the public health system. So they are going to hospitals which are actually now forced to take care of everybody else who are not coming to them earlier. And then they're actually entering into COVID areas. So even a normal, maybe a patient, elderly, hypertensive, who's not really exposed to COVID is actually getting exposed because of what the private sector has done. So strangely, it is not the government, it's actually the private sector, which is in a sense a problem with rights. The second challenges we have had is there's a big raging debate going on in the country about testing and deciding who gets the test and what are the basis of testing itself. And now one can interpret it and say scientific evidence says only these people can be tested, but the other side says who can afford the test? It's pretty expensive in India. It's 4,500 rupees. Can people afford it? The third end, it talks about everybody should have the test. It's my right. And we have had the complication of the Supreme Court butting in and ruling that everybody should be tested if they ask for it, and it should be completely free, and actually mandating the private sector to test free. Now, it looks a little difficult to accept because, especially in the context of an American viewpoint, you can't really force the markets to respond and say, I will give it free. And you don't tell them where the money is going to come from. So is it a violation of the rights of the private sector from that sense? That's something to be, I'm just putting it out there on the table. So all this kind of, the other thing I saw very strangely is this entire crisis, there's been somehow a seamless integration, a separation of sectors. The boundary lines are being very blurred. We really can't separate out public and the civil society groups. Everybody seems to be coming together and responding. How long will this last? How long can it sustain is anybody's guess, but it's something which is happening. But the point I want to actually bring in is social distancing and lockdowns. And in India, you must understand that millions of people migrate within the country. We still call it migration because they move from one state to another. And India, from the background of many of you would know, it is linguistically divided. So our states are formed based on the basis of language. So the state I come from, we speak a language called Kannada. The neighboring states speak another language called Tamil. The third neighboring state speaks a language called Malayalam. So we all speak different languages. But people migrate around the country in terms of jobs. And you got to keep in mind that 94% of India's economy is in the informal sector. So whenever we talk of bailouts or incentives or subsidies, this goes to the formal 6% of the sector. The sector, which in my opinion, doesn't need that kind of assistance. It needs assistance. But the crying assistance is for this 94% of people in the informal sector who are daily wage laborers, agricultural laborers, farmers, who have no organized way of the state reaching out to subsidies and this kind of processes in terms of crisis. But luckily for India, and that's something which is just by chance, the last 4 or 5 years has seen a huge, though I've not been a fan of that process, a huge movement towards what they call the JAM initiative, the JAM initiative, where Jandan is a slogan given for people getting financially included and bank accounts being open for them in every place. So every Indian has got a bank account. Most Indians have a mobile. So they're moving into a digital era where there's an identity card called Aadhaar. And this combination is ensured to the state. One sense, it can be a violation of privacy of the state having information and knowledge about you, but that's exactly the same tool which today is facilitating the state to transfer funds directly to the hands of the poor. So the state's response was immediate and money has been pumped into the hands of the poor, and that's a big relief. But that being said, the big class of people left out has been the migrant laborers. They've all been caught in cities. Lockdown means they can't go back homes, they have no money, they have no food, and the state reaching out to them, and they live in very difficult conditions, very congested conditions. Lockdown means they're all cramped up together. They're not going to be able to follow social distancing. Now that state is responding to this slowly. So I think increasing recognition and civil society action is making this, exposing these problems more. And gradually, just today morning, coincidentally, the government said these people have to be transported back to their respective hometowns. The state is actually intervening now. Till now, they were being fed, they were being taken care of in terms of just food. But again, what kind of food, which food from whom, all these things, I wouldn't get into it. I know time is an issue now. But these people have actually now been transported back. So that's something which I want to bring up. One clear mandate the Prime Minister, the Finance Minister, and everybody else, Health Minister has been talking is India's response has been only to take care of life. They said life first, economy next. That's been the slogan. So that has been the attitude around the country. And to be fair to the actions of the public systems, we might not actually have flattened the curve. At least it isn't as bad as it now. The doubling rates are close to 14 days now. It's been constantly increasing. Things look better. I'm living in a city which is a hotspot, and the cases are coming down. Patients are getting discharged, and we also strangely see a response from the private sector, which is unthinkable for me. Is that a lot of these companies, like an automotive company, is now making ventilators on its own initiative. Unlike the US, where they have to be ordered by the president, here people are actually taking initiative. Somebody's 3D printing masks and shields. Somebody else is stitching. Garment factories have shut down, but they're stitching masks. Various kinds of things. So this is something which is happening. So I think in a situation where India before COVID was seeing an economic downturn, very difficult situation, this has worsened it. And I think the crisis is one thing, but post-pandemic and the way we're going to look at inequities, I come to it in the next question when you ask the challenges of poverty, and that being a violation of rights in the economic recovery that we're going to see post the pandemic is something which is of great concern. So I'm going to stop here and take it forward when you ask the next question.
Thank you much. Thank you
you
very much for giving us an idea of what's happening in a very different part of the world than we find ourselves in. I wanted to remind the audience that there is a Q&A or place that you can submit your Q&A, and we will, after our next speaker, we'll begin to include those questions in our conversation, so please add them. So, Fanula, I'm wondering if you could just talk about what the human rights obligations are that guide states' responsibilities and what you're seeing during this pandemic and what it tells us about how governments respond to using states of emergency.
Great. Thank you. I'm really glad to be a part of this conversation. So in some ways, I think this is both a conversation about a pandemic, it's a conversation about rights, and it's a conversation about the power and the limitations that one can place on the state. And I think there's a couple of things that are really interesting about this moment. One is that if we ever had a doubt before the pandemic that health was a right, then I think that that conversation has almost become mute in this moment, given that we have shut down the entire planet around the protection of the right to health under multiple legal systems, multiple political systems. Now, in some ways, of course, the morning after the pandemic, if there is such a concept, is how do we actualize that right meaningfully, not just once we move away from the question of the debate around the right. So if we think about the rights that are in play, of course, as Barb has mentioned, we have the right to health, which has been found in the Universal Declaration, and it's specifically articulated in Article 12 of the International Covenant on Economic, Social, and Cultural Rights. We also have maybe the predominant right, the right to life, and the right from which all other rights follow, which is the right that is also underpinning much of the rights discourse in this space. And I think there are a couple of important parameters to frame state responses. First, in the context of human rights, we have some rights that we say are non-derogable, rights that can never, ever, in any circumstances, be limited. And one of those is the right to life. And of course, in a context of limited resources, as we've heard from India and other places, but also in Western, theoretically, technologically advanced societies, we're seeing a really fundamental question about the right to life and whether that right can be rationed when there are limited resources to protect that right. And how far does a state's proactive obligations under international law go to protect that right? And we also, of course, know that states have the right to limit rights. So under international treaties, we have what are called limitation and derogation capacities. And derogation means that a state has the right to declare an emergency, to say we are facing such an incredible context of challenge that we are unable to protect all rights equally. And international human rights treaties, including the Covenant on Civil and Political Rights, the Covenant on Economic, Social, and Cultural Rights, allow states to derogate. And public health is one of the stated grounds where a state can derogate or limit its rights. And so what does that mean in practice? Well, it means actually that states don't have a blank check. while they are able to derogate, there are constraints on what limitations states can place in the advancement of protections or policies in the context of a health emergency or a sanitation emergency, as some countries have called it. So the first of these is that any measures taken have to be necessary. And when we mean necessary here, and I think I go back to Dr. Gostin's comments earlier on, it's that any measures taken have to be in place to advance the benefits of health, not to advance 17 other agendas that the state has that are equally or maybe wish lists that a state might wish to take care of under the cover of a pandemic. Any measure taken that limits rights has to be necessary to protect health. The second is that it has to be proportionate, meaning that there has to be some necessary correlation between the measures that a state takes and the advancement of a particular set of protections, here health. And proportionality isn't what I would call a wholesale rule, it's a retail rule. It means that every single measure you take has to be subject to a proportionality analysis. So if you're asking people to stay at home, that requires a proportionality analysis. If you're telling people not to go to work, that requires a proportionality analysis. It requires this step-by-step look at each one of the measures, and it requires states to take flexible measures, making sure that they're constantly evaluating if the measures they're taking are proportionate. The third limitation is it has to be non-discriminatory. And one of the sources I've put up in the chat is the link to the Office of the High Commissioner's website on COVID-19, which breaks down what that means in the context of non-discrimination. We have had a number of other special rapporteurs, including, for example, the Special Rapporteur on Disability, pointing out that there are particular obligations in the context of discrimination to particularly vulnerable groups. And I think that's an important piece of the limits, as Barb says, on states. But the other thing I think we're seeing globally, and that my work in particular has been tracking, is the way in which states are using the pandemic often to do very nefarious things around rights protection. And the second link on the chat function there is a link to a tracker, a global tracker on states of emergency, which the mandate I hold and two small organizations, ICNL and ECNL, have put together, powered by University of Minnesota students who've been volunteering to help populate it, which is really about trying to find out what states are actually doing. Because we are not going to be in a position to evaluate if states are living up to their international law or even their constitutional obligations under domestic law unless we know what they're up to. Because if a state is going to take measures to respond to health, we actually have to know what those measures are. And under international law, there's a requirement of notification and proclamation by states so that they actually tell other states, as well as their own population, in all the relevant languages, so the population knows what's expected of them and what they are doing. And we are seeing, as I've said in other contexts, we have a pandemic, but we also have an epidemic of emergency powers, where we see states across the globe using these exceptional measures to respond to this health crisis. And some of those are clearly meeting the standards of necessity, proportionality, and non-discrimination. But I do want to say that many are not. And many are not because they see the COVID-19 crisis as an opportunity to do other work, as an opportunity to advance surveillance on their populations, as an opportunity to gather large amounts of data on populations and on groups and individuals that they have often sought to have that information on, but haven't had the opportunity to receive before. For many states, it's been an opportunity to dampen down those popular protests that we've seen converging across the globe, often responding to fundamental inequities and injustice, structural inequities in many countries. And so COVID-19 has provided the opportunity to see, to have freedom, restrictions on freedom of movements. So how do we respond to this? Well, the first thing I think we have to respond to from a human rights perspective, when the response to the health emergency is to say, well, we need to take these measures, is to tell governments that they have to be transparent. We cannot hold our governments accountable unless we know what they are doing. The second thing I think we have to do is we have to hold our institutions, our governments, and our courts, we have to hold them open and accountable. We're seeing extraordinary innovation. I'm going to use the example of El Salvador, where in that country there was a challenge to the measures taken by the government on human rights grounds. In Botswana, there was a case before the High Court just in the last couple of weeks when the government had failed to identify lawyers as essential workers, thereby ensuring that no one had access to the courts, challenging that designation. So we have to have open courts and we have to have functional courts. The third thing I think we need sunset clauses. We need to ensure to prevent what both Dr. Gostin and Barb opened with, Professor Fry opened with, is this danger that these things will become permanent. One of the things that many of us who have worked on emergencies for a long time know is that these things don't go away. Emergency powers have the nefarious tendency to persist, to become normalized, and to become part and parcel of what we do every day and the power we've given away to government. And so ensuring that there are sunset clauses and ensuring that there's robust oversight of the measures that are being taken. And also, I think having the conversation we're having today, which is a conversation between health experts and human rights experts about what the framing of need is, and also that we're framing that need in the context of evidence-based policy making, where we have robust discussions about what we know and also what we don't know. And I think in the absence of that dialogue, we could wake up with a health crisis solved, but with much weaker democracies, empowered authoritarians, weakened rule of law, surveillance states in many parts of the world. None of this is the kind of universe in which many of us would feel that we can live a dignified and human rights valued life. And so I think there are enormous incentives both for health professionals and health policymakers to continue this dialogue with lawyers and human rights activists to talk about the kind of world we wake up to post-COVID-19.
Thank you very much, Professor Nielain, and to all of our panelists for such provocative and informative remarks. We have a whole list of really interesting questions, which indicates to me that we have an audience that's paying very close attention to what you're saying. I'm going to categorize them in two, given time, to frame them in these two categories. What are there's a set of questions that have to do with today's political landscape, and what are the short-term barriers and concerns that we have? Sort of how do we get through this short term with the political leadership that is not tending to respect human rights? How can we push in the short term? And then the other set of questions is the longer term. Do we see trends, positive trends that are happening across countries and across developed and less developed countries? And do we see principles, as Fionnuala said, the right to health is suddenly on everyone's lips, but do we see more principles beyond that we can push in a forward-looking way to make sure that the world that we wake up in is not one that has slid backwards, but is actually trying to address some of the gaps that have become really obvious in points of equity and non-discrimination and other things. So I'm just positioning it, if you could all each comment briefly on sort of first maybe we could do a go-round of short-term concerns and then a go-round of the longer term. So Dr. Gostin, can I invite you to start?
Sure. Thanks very much. For short-term concerns, I think we would really want to be worried about governments that use this crisis for other agendas. In the United States for an immigration agenda, in places like in India or China for surveillance or other disempowerment of civil society actors. I think that's one. The other is that just the kind of, the belief that if you just slap on the idea of a public health emergency, you can do what you want, irrespective of actually marshaling evidence that really makes sense, and that you don't put people into risk. I mean, almost every day here in the United States, the president gets up and does something that is really, truly an affront to human rights. Just the other day, he invoked the Defense Production Act not to provide personal protective equipment for our brave nurses and doctors, not for ventilators or testing capacity, but for meatpacking, requiring workers who have died in the dozens and have gotten COVID in the thousands to go back to work in unsafe conditions. So it's a violation of human rights, both collective in terms of the right to health, but also individual. And so it's just, it's troubling to see governments using an emergency as a justification for other agendas, whether it's immigration, surveillance, attacking civil society, undermining the rule of law. I think those are the major short-term impacts that I'm seeing.
Great. Dr. Balu?
In the short term, actually, I have slightly different ways of looking at it. My concerns would be to people and patients who are genuinely suffering from non-COVID related illnesses. And how do we see them? How do we respond to them? Do we value and respect their rights? Is a question which is a big challenge. How do we look at malnutrition in the current context and in the immediate aftermath of the COVID situation? The other concern is we never really notice or look at a sufficiently large number of people who actually are in a daily wage economy, without whom this nation can't move, but they're completely off the discourse, of the debate, and of the narratives. And this lockdown means they have lost access to what they would be earning every day. And how are we going to make sure that they get reintegrated back? What kind of structures and processes are we going to give them? Because they're not the big lobbying, strong voice, which they could negotiate what they want. So apart from what Vasin said, I would have other concerns, slightly other concerns in terms of simple things like immunization. Now, who's really looking at immunization the last 6 weeks? Because primarily it was the state. And what about the right of the child, which needs that vaccine? And what about the kind of illnesses that we are going to allow it to get exposed to in some time from now? And protection of the people in the front line and the safety of these people. And the way I'm not sure if people are following it up at several locations in India. People have been either chased away, beaten up, or not allowed to do contact tracing, because we do a lot of contact tracing across the country. When they go into areas with suspected locations, when they go into areas in a religiously charged up atmosphere, when they go into situations like that, how does it look at? And polarization, the context of polarization amidst the crisis. That's something which I ran out of time in talking in the last 10 minutes. And how does the state respond to this? Till now, thankfully, the state's response has been extremely mature. And every important political leader has been constantly talking about non-discrimination based on religious grounds, which is good news for many of us activists. But unfortunately, it's not the same story with the general public. And that's what is so disheartening. With common people, polarization is increasing, whether it's a net outcome of the political voices of the past leading on to that situation, or the media even. So I think the way we generally tend to hold the state responsible for all rights violations, but I'm concerned that everybody is participant to the rights and the rights violations that can happen, and how do we look at all these things? And sometimes overreach of the judiciary itself. Like I give an example, the Supreme Court can simply decide you have to do this test free in the private sector. And how do we actually enforce it? Who enforces it? How do you enforce it? How do you even get it done? So to me, short term, beyond the surveillance, beyond these challenges, the real at the ground and experiential level, who's going to take these decisions? How does it play out? Who takes the call? We have such a shortage of ventilators. Thankfully, in our country right now, we don't have too many people needing ventilators. But if the call has to be taken at the last point level, that who should go on a ventilator? And how do you even decide the rights of the patient who's going to be ventilated? And I know these are challenges a lot of my colleague physicians in the US are already facing. Whom do you take off the ventilator? Whom do you put on the ventilator? And challenges like this. And I'm sure we might have to, at some point of time, face. And then simple things like science says hydroxychloroquine. I don't think science says it. Science has been very measured about its opinion about hydroxychloroquine. But just because of this global narrative of hydroxychloroquine and India being the largest supplier of hydroxychloroquine, everybody thinks you pop a pill into your mouth, you're protected. And I'm creating this kind of, to me, it's a violation of rights to create even that kind of propaganda, especially by people in responsibility and in positions of power. And rights violation of countries in this way, from statements made outside the country and the kind of fanfare it gets. These are things which we never thought about in the past, but I think these are real now. And these are a few challenges I just brought. The short term.
Thank you. Dr. Nieland, thoughts on the short term? A lot of questions are doing with the current political landscape and how we can get beyond it or turn the table in the short term.
I just had a couple of thoughts. One is just to think about what mobilization and movement building looks like in a COVID and post-COVID, because I think post-COVID is not a day, it's a process, as someone said. And I think it's also thinking about how we both enable participation in a context where, in fact, the limitations are functioning against that. And I think that's actually going to require a great deal of innovation from civil society itself and from and to in fact engage civil society in a way that is innovative, that forces voice into public space when physical bodies are absent. I think that's something we have to think about very carefully. We also have to tend to our civil society and ensure it survives. There's a lot of discussion about business survival right now and the kind of props that are being put in various countries to do that. But civil society is an active organism, many of whom will not survive this without the financial and other supports that are needed to, in fact, ensure that kind of vibrant debate. So I also think we have to think about the sort of survival of civil society as one of the things we have to think about in the short term. The second thing I want to just focus on is just coming from the counterterrorism and human rights space. I do want to say that it worries me slightly that we have, not slightly, it worries me quite a lot, that we have much of the security sector telling us how useful they're going to be in responding to COVID-19. And that, I think, is a really, really problematic shift. That the security sector itself in the counterterrorism space has been broadly unaccountable, and it has generally been a rights-free zone. And so the idea that this industry will make itself fundamentally sort of reshift and repurpose itself into health, I think works against so many of the fundamental principles of equality, non-discrimination, transparency, openness that we are also. When we have companies offering to do that work, we as civil society, as experts, as academics need to be saying, no, actually, that's not where we need you, and we don't need you in these ways. And the third thing I would just say is that business has human rights obligations. We have established this, and it is not a human rights free zone. And I think one of the things that's really important in the issue that's been raised around the obligations on the private sector is when many private sector companies are bigger than and more powerful than states, I think it would be it's an anomaly to suggest they don't have human rights obligations. There are human rights obligations to be observed by private entities. And I think it's the articulation of those human rights obligations at this moment that is particularly important, as some countries more than others are leaning into the private sector to do the work for them.
Great, thank you. So let's shift a little bit to the long term, and let me just introduce this round of responses by reminding us that the United States in particular has not really been, the government has never taken economic and social rights with the seriousness that they deserve, and certainly not as equal to the civil and political rights, which tend to grow out of our more constitutional space here. And yet we have this this binding document, this treaty that has 170 different states, parties moving towards universal ratification, which still stands as a really robust baseline of the obligations of states, well, we can think about what obligations individuals have as well in the context of those rights. So I did want to remind us that we have some remedial work to do in the United States context to bring to visibility the great jurisprudence and advocacy that have been done around the right to health as well as other economic and social rights globally. And so I'm wondering, beyond that, in sort of that being part of the U.S.-based agenda and maybe some of the other Western states, what are our long-term strategies for dealing with this? Since we've seen the gaps that have been glaringly exposed because of the inequalities in our communities. What do those gaps tell us about where the long-term work is that we need to push towards? So again, we'll invite, I think we have about 2 or 3 minutes for each of our panelists to weigh in on that long-term vision. Dr. Gustin.
Sure, thanks. I mean, I would say, two things. I mean, one is the equity agenda. I think what COVID-19 has really shown a light on is the gross inequalities that are faced both within countries like the United States and also among countries, and the absence in particular of social safety nets. On the face of it, when you have a stay-at-home order, whether it's in India, China, or Italy, or the United States, on the face, it seems to apply to everyone equally. But if you actually look at it, it's just fine for people that can telecommute, have well-stocked cupboards and fridges, have internet access and can teach their children. And for them, it's a completely different reality than for somebody who is either lost her or his job or has to venture out to dangerous places to do that. In some parts of the world, and even in some countries that are rich countries, sheltering in place is just not an option. If you look at the major slums, for example, in India, or if you look at the mega cities in sub-Saharan Africa where COVID-19 is about to march through, you can see enormous inequalities. And then going forward, where once we do get an effective treatment and vaccines, how are we going to equitably distribute it? Or will it be hoarded by the United States, Europe, and in Japan and other high-income countries? So these are questions of equity are really important. I don't have time, but I think for another occasion, we should talk about how we can strengthen another treaty, which is the International Health Regulations, which is the governing framework for dealing with public health emergencies of international concern. That framework is supposed to balance human rights with public health and travel, but it hasn't worked out that way. And so that urgently needs reform as well. So thank you very much for hosting this, and I'll turn it over to my other two amazing panelists.
Thanks, Dr. Austin. Dr. Balu.
I actually think this is a great opportunity, like Professor Gostin mentioned earlier. Maybe we need to look at redefining the very notion of human rights. So I think in a particular context is what the whole definitions of human rights emerged. I say this particularly because, at least in the common narrative, I can definitely say about India, the whole focus has been mostly on either social, civil, or political rights. We haven't really looked at economic rights with the seriousness that it deserves. And I think the long-term strategy should be, and at least this crisis is exposed to people, and there's inequities where lack of economic rights has been clearly, evidently exposed. The second context of the rights that I would like to bring in is we haven't really seen digital illiteracy as a lack of right. You know, I have a right to be digitally literate because everybody talks about protecting the technology economy, the knowledge economy. But what about the farming economy, especially in countries like India, where social distancing is completely irrelevant because the very fabric and structure of rural India, it thrives on social aggregation. The economy thrives on people coming together, and there's no way how they can even talk of distancing. That's a reality. Now, how do you even deal with 60% of India, 65% of India lives in villages, and you want to reaccommodate them with an economy? So solutions are very urban-centric. Solutions are very technology-friendly. So we haven't really, and what about the rights of these people? So can we even look at rights from an urban perspective, rural perspective? And in this entire narrative, we haven't even spoken about indigenous communities and the rights of indigenous communities. And in several indigenous communities where I operated, many people came up to me and said, I'm going to take my traditional medicines. Now, what do I tell him? Do I tell him you have a right to choose to take traditional medicines and possibly succumb to the disease if it affects you? Or, no, you can't do that. You got to practice social distancing and you got to stay at home in a house. And the entire house is a 100 square foot house with 6 people living in it. How are you even going to exercise social distancing? So it's very easy for us to think of all these solutions in an ecosystem where it can work. But with 1.3 billion people, I think we have to develop a new narrative of human rights. For me, I would even say we should say being poor is a violation of human right. And if we can really look at poverty as the worst form of violence, I would classify it as a real lack of human right and something should be done. And the last point I want to make is this crisis has exposed the very understanding and definition of what is a public good and the obligation of the state to provide that public good. So I would actually add up access to public goods and services should become fundamentally a human right. And before I conclude and thank you all, I think we got to see human rights beyond humans too. And today we have taken this planet to the point of destruction. We're constantly focusing on just the humans and excluding everybody else. So I think being responsible towards the planet is also a matter of right. And this is something we need to keep in the discussion as we go ahead. So thank you all once again. It was a great pleasure and a privilege to be part of such a wonderful discussion. Thank you, Barbara.
Thank you, Dr. Balu. I look forward to connecting with you as we proceed with this.
Sure.
Dr. Neeline, will you give us your thoughts on long term?
Yeah, I saw a great tweet yesterday which said, the revolution will not be quarantined. And I think maybe that's a good way for us to think about how we go forward. I do think that this is a really important moment to speak to the indivisibility of rights, to bring back that idea that it is meaningless to talk about civil and political rights without the underpinning structures of economic, social, and cultural rights. I think where does that have to be practically implemented? It has to be implemented in the commitment of states to the SDGs. It has to be committed in national level politics where demands from the bottom up, which I think this is not simply about health and home, it's also about access to what some of the solutions to the crisis presume access to fundamental rights that many of us don't have. And I also just, coming from a very collectivist society, Ireland, I know that in fact, if the solution here is actually to destroy the cultural links and the values that people hold in living whole and dignified and meaningful lives, then actually the solution will be worse. The cure will be worse than maybe the harm itself. Finally, I just want to acknowledge, and I think one of our Janet asked this question in the Q&A, is about the gendering of the pandemic. This pandemic does not fall equally on men and women. This pandemic has clear gender dimensions in the burden of care, in the informal economy. It has clear implications for violence and freedom from violence when the home is the solution. And so the other piece of this big puzzle as we think about how the revolution will continue through the pandemic is actually to view this also as a transformative moment in a discussion about gender relationships and gendered responsibilities. So let me end there.
Well, again, thank you all. This has really been a great discussion, which has popped up new questions and conversations which we hope to pursue in future parts of the series, and maybe we'll invite you back as speakers for those. And we thank the attendees who joined us today. There were some excellent questions which we'll reserve and will help to guide us in the future. So again, thank you, Dr. Gostin, Dr. Balu, and Dr. Nieline for joining us today.
Thank you.
Thank you.
Thanks, everyone.